Welcome to the Deep Dive, the show where we really try to cut through the noise and get straight to the crucial insights you need. Today, we're plunging into a topic that's, well, it's weaving its way into nearly every aspect of our daily lives. And nowhere is its transformative potential maybe more evident than in healthcare. I'm talking about artificial intelligence. Specifically, we're doing a deep dive today into ChatGPT, a really powerful AI, and its rapidly evolving role in medicine. Our mission today, really laid out by this comprehensive source material from Tangsrivimol and colleagues, is to explore the honestly sometimes surprising benefits, but also the crucial limitations and the emerging risks of bringing ChatGPT into clinical practice, medical education, research, all of it. You're going to walk away with some really fascinating facts and I think key insights.
Yeah, and just to set the stage a bit, it's important to understand what ChatGPT actually is. It's a large language model, an LLM. Basically, these models use artificial neural networks, and they're trained on just colossal amounts of text data. Think books, documents, huge swaths of the internet. And this lets them use deep learning to, well, comprehend, summarize, generate, even predict text, all by discerning these incredibly complex patterns in language. ChatGPT, especially the newer ChatGPT-4 from OpenAI, is a really prominent example of this tech.
Okay, let's unpack this then. So our source material gives us this really comprehensive analysis across 6 key areas. We're talking everything from information and education, which seems foundational, right?
Yeah.
All the way to its role in mental health care and even very practical things like language translation. It's a fascinating look at how this tech is, well, really changing the game. And this deep dive, I think it'll reveal some crucial insights you might not expect. So kicking us off, let's look at the big picture first. ChatGPT has already shown what the source calls transformative technology impacts in healthcare. When we talk efficiency, what are some of those headline-grabbing gains we're seeing right away?
Well, the numbers themselves are pretty stark. Some studies have shown a really remarkable 70% reduction in the administrative time it takes to generate discharge summaries.
70%.
Wow.
Yeah.
Think about what that means for a busy hospital, right? That's hours back in a doctor's or nurse's day.
Yeah.
But it's not just efficiency. ChatGPT has achieved what's essentially medical professional level performance on standardized tests. It hit, for example, 60.2% accuracy on the USMLE. That's the big U.S. medical licensing exam. And 78.2% on PubMed QA, which is a key benchmark for, assessing medical knowledge.
Right.
That's not just impressive. It's potentially a game changer for how we even think about acquiring foundational medical knowledge.
60% on the USMLE.
Yeah.
Yeah, that's genuinely astonishing. It makes you wonder how these LLMs actually work under the hood. And, where does ChatGPT fit in with other AI tools in medicine? Is it the only player?
It is remarkable, isn't it? So these LLMs, like I said, they learn from vast text data sets. They figure out context, generate coherent text. ChatGPT, especially GPT-4, is super versatile, conversational across lots of medical topics. But no, it's definitely not the only AI tool making waves. You've got Google Bard, for instance, which is really designed for more human-like interaction, maybe used more for patient engagement. Bing AI, which also uses GPT-4, tends to focus more on knowledge retrieval, pulling from up-to-date resources. And then there are more specialized ones like Copilot, helping with things like medical coding or even developing algorithms. What's really fascinating, though, is just how fast they're evolving. ChatGPT took a big leap forward in early 2023 with GPT-4. And our source material really dives into how this is already finding, practical uses in everyday healthcare settings.
Okay, so with that groundwork laid, let's get into where this technology truly shines and maybe where it struggles a bit. Across those 6 key areas the source highlights. Let's start with information and education. The paper notes its exceptional capabilities here. What does that actually look like?
It's pretty powerful in this space. ChatGPT is great at explaining complex medical conditions, treatments, preventive measures, just breaking things down. This is a huge help for both patients trying to understand their health and for professionals maybe refreshing their knowledge. And as you mentioned, those exam scores are really notable. 60.2% on USMLE, 57.5% on MedMCQA, another knowledge test, and that's 78.2% on PubMed QA. It also seems pretty strong in clinical reasoning tasks, getting like 84% accuracy on what they call lower order thinking questions. So it helps understand complex diseases, at least at that level.
So clearly a whiz at recalling facts and, basic reasoning. But here's the critical question, isn't it? Passing an exam doesn't automatically mean you're a competent professional ready for anything. Where does that exam success kind of stop and real-world clinical competence begin? What are the limits here?
That's the crucial distinction, absolutely. A major limitation, for example, is that ChatGPT just can't process visual information. It can't see. So studies, like one looking at the radiology board exam, showed this fascinating split. ChatGPT did great on the factual recall, the lower order questions you mentioned, hitting high accuracy.
Right.
But it completely failed on tasks that required describing an image, doing calculations based on an image, classifying things visually, or applying complex concepts shown in images. It just can't look at an X-ray or an MRI scan and interpret it like a radiologist.
Okay.
And beyond that, experts like Dr. David Ash have highlighted other critical things we have to consider when integrating AI. Things like, patient data privacy, security, the whole regulatory compliance piece, the quality of the data it learned from, and this is key, the absolute necessity of human oversight. Always.
Right. Let's shift gears then to triage and symptom assessment. How could ChatGPT help streamline that initial patient intake, the bit that often bottlenecks clinics?
Yeah, it can play a really pivotal role here. It can ask patients initial questions about symptoms, assess the responses based on its programming, and if something sounds urgent, it can flag it for a doctor quickly. So this could definitely ease the workload on medical staff,
Yeah.
potentially even improve that initial assessment process. Some studies have shown it can be pretty efficient and accurate in these specific, limited scenarios.
But there's always a catch, isn't there? Or maybe a strong caveat. What's the big one here for using it in triage?
Oh, absolutely.
Mm.
The reliability of ChatGPT in triage is heavily dependent on its training data, the knowledge baked into it.
Mm.
And that inherently limits how well it can adapt to the really nuanced, often unpredictable situations you get in actual clinical practice.
Mm.
Real clinical work needs so much more than just data analysis. It needs experience, critical thinking, interpreting subtle cues, things LLMs just aren't equipped for yet. It's a tool for maybe initial screening, but definitely not for making the final call.
Okay, that makes sense. Now, thinking about staffing challenges, especially in remote or underserved areas, how does ChatGPT fit into telemedicine, remote monitoring and support?
It can definitely be a valuable tool there, offering significant support. ChatGPT could say, monitor symptoms reported by a patient,
Mm-hmm.
create detailed symptom lists for the doctor, provide guidance for managing chronic conditions, help with medication adherence reminders, maybe even assist with guiding post-operative recovery steps. Research on its public health utility showed it can offer info on health promotion, disease prevention, even explain community health worker roles or local programs.
That sounds incredibly helpful for extended care, getting information out there. But I imagine there were limitations found in that public health study, too.
Yes, very much so. That study pointed out issues with accuracy, potential biases creeping in from the data it was trained on, a lack of real contextual understanding, sort of limited engagement capabilities compared to a person, and importantly, the absence of direct, real-time interaction with a healthcare professional. But despite those, other studies show promise in specific niches. For example, one found that AI-driven text-based health coaching actually led to successful weight loss, sometimes even better than in-person coaching, which is interesting.
Huh.
And on the admin side, again, generating discharge summaries, it can definitely help with workload. But, and this is crucial, physician review is always essential because of potential errors or missing details. Its use for other treatment records is also growing, apparently.
Okay, moving on to mental health care assistance. Such a critical area, especially now. How can ChatGPT help patients who might be dealing with anxiety or just struggling to understand their condition?
Well, it can provide things like coping strategies, maybe guide someone through self-help techniques, offer general information about conditions, and potentially even provide some level of emotional support textually. In discussions around the global mental health crisis and burnout among healthcare workers, ChatGPT itself suggested ways it could help. Things like initial mental health assessment screening, symptom checking, emotional support bots, patient education, remote consultations, and for the professionals, maybe automating admin tasks, offering clinical decision support, even emotional support tools for them to combat burnout.
That sounds like it could be a real lifeline for some people. But what happens when you put that AI interaction side by side with genuine human connection, especially in something as sensitive as mental health? Did the research look at how patients actually feel about interacting with an AI versus a person?
That's a really profound question, and yes, they did look into that. A study comparing ChatGPT to human interaction in radiosurgery consultations found something quite telling. While ChatGPT was effective at conveying factual knowledge, answering specific questions accurately,
Mm-hmm.
it significantly lacked compassion, empathy, that human touch, the reassurance that patients really seek from their doctors.
Yeah.
And the researchers concluded these aren't things current AI is expected to resolve anytime soon.
Hmm.
It highlights a fundamental difference in the kind of care they can offer.
Okay. Let's talk about research and decision support now. Medicine moves so fast. How does ChatGPT help researchers and clinicians keep up and make critical decisions?
It can be an incredibly valuable assistant here. Like a super efficient research aid, it helps professionals stay updated with the latest research papers, guidelines, protocols, just sifting through mountains of text incredibly quickly.
Right.
It can also analyze patient data, in theory, to assist with suggesting diagnoses or treatment plans. And the source also notes it's becoming quite popular as a tool for actually drafting research papers, helping write abstracts, even main sections of papers.
This area, though, seems to bring up some really significant ethical red flags, especially around something called artificial hallucination. What exactly is that, and why is it such a big worry for scientific integrity?
Right? Hallucination is the term, and it's alarming. It's when the AI generates information that sounds plausible, maybe even uses technical language correctly, but is factually wrong. Or worse, it invents things entirely,
Yeah.
like citing references or studies that don't actually exist.
Wow, really? It just makes them up.
Yeah, it's been documented. ChatGPT fabricating references that look completely real. In one experiment, researchers found that human reviewers often struggle to tell the difference between real scientific abstracts and ones generated by ChatGPT. A significant chunk of the AI ones got past them.
Oh, boy.
So yeah, it raises a massive question for scientific integrity, doesn't it? How do we trust research if AI can convincingly fake data or sources? Mitigating this needs really thorough training, testing with diverse data, and constant vigilance. Plus, another study found ChatGPT wasn't consistently making accurate diagnoses even when fed relevant data from WebMD. It tends to do better on like textbook questions than with complex real patients who have messy medical histories and psychosocial factors. It can assist with maybe predicting text for physician notes or suggesting billing codes like ICD codes, but it absolutely cannot replace the human physician's judgment. And the FDA currently has pretty strict limits on advanced AI use in direct medical decision-making, underscoring that caution.
Okay, last area. Language translation. Healthcare is often multilingual. How does ChatGPT help break down those communication barriers?
It actually offers pretty impressive real-time translation. That's a huge benefit. Research found it performs really well in popular languages, like major European languages. In some cases, apparently even better than standard tools like Google Translate.
That sounds like a potential game changer for international patients or diverse communities. But even with that strength, what are the remaining challenges for medical translation specifically?
There are definitely still some significant hurdles. Translating less common languages can be tricky. Sometimes it has to do this awkward two-step translation through English first.
Okay.
And crucially, when translating medical information, the AI often outputs conversational language, not the precise, specific medical terminology needed in a clinical setting. Nuance gets lost.
I see.
So human oversight is still absolutely essential. You need someone to check for accuracy, cultural appropriateness, and potential biases in the translation. It's a powerful tool, but not foolproof for delicate medical conversations.
So, okay, we've dived into these specific areas. Let's pull back again to the big picture.
Yeah.
What does this all mean for healthcare delivery overall? The source suggests that while the potential is significant, the actual improvements right now might be more modest than initially suggested. Can you elaborate on that?
Absolutely. The evidence paints a mixed picture, really. Clear potential, but also clear limitations that temper the initial hype sometimes. Take clinical documentation like those discharge summaries again. One study found that while, some AI summaries were good, needed little correction, a pretty big chunk, maybe 45%, were rated unfavorable because they needed substantial edits. And those hallucinations, the AI making things up, occurred in about 40% of the AI summaries in that study.
40%, that's huge.
It is. And many of those were considered highly clinically relevant errors. Minor content mistakes were also more common in the AI versions compared to human-written ones.
So even with potential efficiency gains, it's definitely not just a set it and forget it solution then.
Precisely. Not at all. In fact, human healthcare pros could spot the AI-generated content with pretty high accuracy in some studies, which suggests there are still distinct qualitative differences they pick up on. All this points towards ChatGPT being a valuable supplementary tool, an assistant rather than a replacement. But it's important to stress the positives, too. There's that reported 30% reduction in admin burden in mental health care settings. And AI triage systems have, in some cases, demonstrably improved access to initial care. So the value's there, but it's in specific, well-defined roles right now. And, if you look across the board at the quality of evidence for ChatGPT in different healthcare areas, a kind of hierarchy emerges. The strongest evidence right now seems to be in documentation and medical education. That's where we see those 40–70% efficiency gains in admin time, those high scores on medical exams. Pretty solid.
Okay.
Then there's clinical decision support. The evidence there is more moderate. You see accuracy rates for things like suggesting differential diagnoses in the 70s, 80s, even low 90% sometimes. But it consistently falls short of experienced human clinicians, especially in complex cases.
Yeah.
And then direct patient care, anything involving direct interaction that currently has only preliminary evidence. Performance is super variable, and there are major limits where emotional intelligence or complex judgment is needed. So this hierarchy really suggests we need a staged implementation approach, right? Start where the evidence is strongest, be more cautious elsewhere. And critical success factors for actually using this stuff effectively. It seems to hinge on integrating it smoothly into existing workflows, really training staff properly, having clear human oversight protocols, and constantly evaluating how it's working. Which brings us squarely to the crucial ethics and privacy concerns. Integrating powerful AI like ChatGPT into healthcare isn't straightforward. There's a real risk of bias in the AI's decision-making. If the data it learned from reflects existing health disparities, the AI could actually perpetuate them.
That's a huge concern.
Definitely. Data privacy is another massive one. We're talking highly sensitive health info. So you need robust safeguards, end-to-end encryption, strict access controls, clear patient consent to comply with rules like EPS-IPA and GDPR.
Right.
Regulatory compliance is also key. Policymakers need to set clear guidelines, emphasizing things like explainability, can we understand why the AI suggested something, and accountability. FDA guidance is starting to emerge here. And then there's this concern about over-reliance. Could depending too much on AI actually hinder the development of clinical judgment in younger professionals, a sort of de-skilling effect. It really raises an important question for you, for everyone listening. How do we strike that balance, leveraging this powerful tech while preserving essential human expertise and, crucially, patient trust?
So if we distill everything we've talked about, the core limitations seem pretty clear from this deep dive. ChatGPT currently lacks real-world clinical experience. It just hasn't seen patients.
Right.
It can't process visual data, x-rays, scans, even just looking at a patient. It completely lacks emotional intelligence, empathy, the human connection part.
And there's that persistent issue of artificial hallucination, where it confidently makes things up.
Yeah.
These points really hammer home that, yeah, it's a valuable supportive tool, but it absolutely cannot replace human medical professional.
Exactly. And looking ahead, thinking about the future. As ChatGPT and similar AI models keep evolving, which they will rapidly, their potential impact will undoubtedly grow. In medical education, you could see truly personalized learning platforms. For clinical decision support, maybe improved accuracy makes it an even more vital tool for analyzing real-time data, suggesting treatments.
Yeah.
In patient care, maybe future versions get better at remote monitoring, chronic disease management, perhaps offering more personalized health advice. Although the empathy piece remains a huge question mark, it also definitely stands to accelerate research and development workflows. But achieving that vision needs ongoing focused work, improving accuracy, especially in complex cases and with visual data, enhancing anything resembling empathetic responses, which is hard, and crucially, building better safeguards against hallucination.
And the ethical considerations, data privacy, regulatory compliance, those aren't going away. They'll remain critical. So if we connect this back to the big picture, ChatGPT's role, for the foreseeable future anyway, looks like being a powerful assistant, augmenting what healthcare providers can do, boosting their capabilities, but not replacing them.
So to wrap up our deep dive today, the core takeaway seems pretty clear, doesn't it? ChatGPT is a significant technological leap. It has proven benefits in efficiency, information processing in healthcare. It can streamline tasks, give quick access to knowledge, maybe even improve patient engagement sometimes. But, and it's a big but, it comes with distinct crucial limitations, especially around complex human interaction, visual data, and that absolutely irreplaceable element of empathy.
That's precisely right. Knowledge is most valuable when it's understood and applied correctly. And the current evidence really points to a symbiotic relationship. ChatGPT shines as an augmentative tool, an enhancer, not a replacement. Its best uses right now are in those structured tasks, documentation, education support. While the areas needing nuanced human judgment, emotional intelligence, visual interpretation, those still absolutely demand human oversight and expertise. We have to integrate it carefully.
So As AI continues its incredibly rapid evolution, what kind of healthcare system are you envisioning? The listener, I mean. Is it one where technology just streamlines the background work, maybe gives doctors back more time with patients? Or is it one where it fundamentally reshapes that patient-provider relationship in ways we're only just beginning to grasp? How do we ensure this powerful assistant truly enhances the human element of care instead of somehow eroding it? Definitely something to mull on until our next deep dive.